Hi, this is Dr. Eric Donor at the New York Skin and Vein Center, and today I'm going to be demonstrating cheek augmentation. So starting about the age of 35, a woman starts to lose the equivalent of 1 syringe of filler per year in their face. They lose fat and collagen, and the muscles in the skin get thinner. And cheekbones are a big place where we all lose volume, plus we have gravity and descent. So if you're losing volume, we replace it. What do we replace it with? Well, there's 4 different substances. Today we're going to be using something called Voluma made by Allergan. And we're going to be using the cannula technique. With one little poke way back here, we can fill in the whole cheek and bring it back to life. Now, we're not trying to make huge cheeks like Kim Novak or supermodels. We're just trying to restore the cheekbones that you used to have. In so doing, it reestablishes the proportions of the face, and it actually helps lift the folds around the mouth. So rather than injecting here, we inject here to help restore the contours in the cheeks. So that's what I'm going to be doing right now. So on this young lady, we're going to be starting way out here and then restoring these cheeks and give her a little bit of a nice lift. We'll be using 1 syringe on each side. I'm going to be starting on this side. She's already numbed up. You can see that I've made some markings here, and this is where I'm going to be starting. So now we're going to work. All right, this is the cannula. It looks pretty big. It's very comfortable. And here we go. So we're going to start high. Help with that hollow here, and then lay a layer. And then we're going to go down and lay a layer. And then we're going to go down and lay a layer. And that's about 0.1 to 0.2. And the layer. And we're going to go down again. And you can see she seems pretty comfortable. Again. Okay, now we're just going to take a peek, and you can see the difference already. All right, the height of the cheekbone is improved. It's lifted here a little bit. It's helped with that little concavity there. It's actually helped under the eye as well. And if you look at the difference, it's subtle, but it's definitely there. We'll just have to do a little bit of molding here. I have a little bit left, which I'm going to put right into this area. Yep, and you can see that little hollow there is greatly improved. And that's it for that syringe. All right, so you can see the difference between the 2 cheeks. The nice softening here helped restore the cheekbones. I'm going to mold this now. All right, so that's what we're going to show today. This is Dr. Eric Donor at the New York Skin and Vein Center. Hope to see you soon.